Every year, Toronto police receive over 30,000 mental health related calls. And in some cases, it's a specialty group that's sent to these scenes known as a mobile crisis intervention teams. Tonight, we speak with the group on the forefront of responding to these emergencies.
I am a police officer. The only thing is that I'm currently assigned in the specialty role. Obviously, I've had some specialized training in mental health.
Sergeant August Bonomo is part of a team made up of 16 Toronto police officers and between 35 to 40 nurses, a partnership between police divisions and 6 Toronto area hospitals.
It brings a compassionate response, and it utilizes the two different types of systems, both the justice system and the healthcare system, to respond to something that is not a criminal event.
When an MCIT team is deployed to a scene, their focus is on de-escalation, removing someone from causing harm to themselves or others, providing counseling and access to treatment.
Having the nurse right there who's able to do an assessment in the community, it's like bringing the clinic to the community and being able to help in that situation and connect that person to the appropriate community resources.
The number of mental health calls to police has been steadily climbing by thousands each year. Of the now over 30,000 annual calls, the 10 teams respond to a little over 6,000. They operate 7 days a week between 11 a.m. and 11 p.m. depending on the needs of the community, so they're not available 24/7.
It's a funding and capacity issue, but that is being looked at, and there are some formulas out there that we're working towards moving in that direction. It may not happen overnight.
Officers and nurses on the team must complete 40 hours of course training and additional continuous education quarterly. The public will have to call Toronto Police to get an MCIT team to the location. In some cases, the team isn't the first responders in mental health calls. For example, when a weapon is said to be involved.
The nurse is not a police officer, so they're not authorized to use force if force is necessary. They are not trained, and they are not equipped to use force.
But as calls to defund the police have continued, concern has also been raised about armed police officers responding to mental health calls.
Defund the police! Defund the police!
In a statement released last month, CAMH said police should not be the first responders when people are in crisis, adding that they are not trained and should not be expected to lead this work, calling for transformative change, where instead mental health responders would be first at the scene.
I think we should be at the table. Whether do we need to lead it? No, and we've never said that we should be the lead. Unfortunately, with deinstitutionalization over the years, we have become the de facto street level psychologists, right? Whether it's been thrust onto us, probably not by design, but by system gaps.
The Mobile Crisis Intervention Team started as a pilot in the year 2000, and both Sergeant Bonomo and Leah Dunbar say they're eager to continue improving the team.
More of a wraparound approach, more of a layered type of response, more of a triaging of response, greater working with our community partners.
We love partnerships. We love working with people, and that's really where we can innovate and change and help the community.
Other police forces in the GTHA have also followed in the footsteps of Toronto Police. The latest, Peel Region, who earlier this year established their own mobile crisis unit in partnership with the Canadian Mental Health Association. For City News, I'm Faiza Amin.